Hi, I'm Dr. Amy Addis from City Pets, a house call service in Manhattan. If your pet has been diagnosed with diabetes, you're probably overwhelmed with all the things you have to remember. We made this video for you to watch over and over again so that you feel more comfortable with how to handle your insulin and your syringes. Insulin comes in a variety of different types, and it's very important that you note whether you have U100 insulin or U40 insulin. U100 insulin must be used with U100 syringes, and U40 insulin must be used with U40 syringes. The reason I stress this is if at any point the type of insulin that your vet has recommended has changed, you need to make sure that you are always using the appropriate syringes. Syringes and needles make everybody nervous, but they're not that scary. So I'd like to talk to you a little bit about the proper handling of a syringe. My syringe has 3 parts: the needle, which is now covered by a red protective plastic, the barrel, which is marked off in the number of units, and then on the end is the plunger, which is covered by another protective plastic. Okay? On the barrel, you can see there are hatch marks which indicate the number of units. So the most dangerous part of handling a syringe is when you uncap the needle. And I'd like to demonstrate for you the best way to do this is when you uncap to extend your arms as far as possible to avoid sticking yourself with the needle. When you go to recap the needle, make sure that you are inside the protective cover before you put it on. Okay, now I'd like to demonstrate how to fill the insulin vial. When you take the insulin from the refrigerator, it's important to get the insulin into suspension. And the best way to do that is to roll the bottle between your hands. Once you've done that, you want to clean the top of the vial with alcohol and cotton to keep it sterile. I'm going to open my needle, and once I've done that, I'm never going to put this down because this is a sterile needle. I'm going to stick it in the top of the bottle, and once I've done that, once I've put the needle into the bottle, the rubber of the bottle will hold the needle in place, and you can use your other hand to draw back on the plunger until a little bit more than the desired number of units. At that point, pull back on the plunger until past the number of units that you want to administer. Make sure there are no air bubbles inside the syringe. Push the plunger up to the desired number of units, and then you can remove the syringe from the bottle. And we're going to recap the syringe now, and in the next video I'll demonstrate how to give an injection. This is Dr. Amy Addis from City Pets in Manhattan.